Hello everybody, I am Dr. Abhishek Dagar. I work as a senior consultant in Venu Institute and Research Center, New Delhi. I hope and I sincerely believe whatever I am going to talk about in the next 10-15 minutes, I would be talking about general eye care and eye diseases. Would benefit you and would benefit anybody with any kind of eye diseases. Now, first and foremost, the eye, we really underestimate or we undervalue the eye, which is one of the most important sense organs of the body, until something goes wrong with it. And usually, the things which go wrong with the eye can be prevented, or the eye diseases, most of them can be treated and treated fully if detected early. Some of them are not even diseases. First I would like to talk about refractive errors. Refractive error per se, wearing a spectacle, a lot of people wear spectacles. Wearing spectacles is not a disease. It is just that eyeball is shaped differently from the normal. And most of us go around using 60% of our vision, fearing that wearing spectacles is a disease. So first, I would like to address the vastly, untouched problem, or the problem which faces most of the people, and that is refractive errors. For the record, everybody has to wear glasses at one point or the other in their lifetime. Either they'll wear it before 40 years of age, or they'll wear after 40 years of age when the reading glasses catch up with you. So wearing spectacles is something which is not good. Now, essentially, everybody, every educated person, everybody who has access to eye care or a service of an optical shop or an optometrist or a spectacle shop or an eye care service provider or hospital clinic should get their children checked for their eyesight. A pre-verbal child, even a child as young as 3 years, 4 years, can be checked for his or her eyesight. If you feel that your child is not developing as good as others, or your peer group or your neighbor's child is not playing, even a child younger than 3 years, if he's not picking up a ball, say, or a toy, or is not finding objects, colorful large objects, you should get the child's eyesight checked, because the damage done to the child's development, if the eyesight is not corrected during the formative years of 3 to 8 years, is irreversible. And sometimes it is as small as getting the child a pair of spectacles. In some of the developed countries, in fact, it is mandatory for school admission. The child should have a clearance from an ophthalmologist or an eye checkup done. It is mandatory. It is not mandatory in India, but anyway. So the first thing is, if the refractive error, the wearing spectacles is a big problem. Every fifth person, if they get their eyesight checked, would find that they have some or the other refractive error. It is as large as that. Especially educated people, now it has come out, there are studies which show that countries which have a higher level of education, which are more developed, have more people wearing spectacles. So in India especially, when with the education levels going up, everybody should go in for a spectacle checkup. And essentially, even when the young people, they are in the school, their education is hindered if they can't see the blackboard properly. So if the school teacher tells you that your child is not seeing the blackboard properly, don't insist that just move the child's chair to the front or ask the child to be seated in the front row. Get your child's eyesight checked. That's one. Two, the other thing which a lot of people are scared of is getting to, when they start needing glasses for near. At around 40 years of age, everybody needs glasses to read the newspaper or look at your mobile phone or do near jobs, looking at a computer. Now, these are things which are natural. This is not a disease. And just trying to not wear glasses and say that, I won't wear it for the next 2 years, I'll wear it only when I'm totally blind. That is foolish. So if you need glasses, go to your nearest checkup point. It can be an optical shop, it can be an optometrist, it can be an eye care service provider, it can be eye hospital, it can be an eye clinic. Get your spectacles and start using your eyes to the fullest. Now coming to the diseases, as in diseases, I would like to point out a few of them, starting from the foremost, which usually people talk about, and that is cataract. Again, cataract is sometimes a natural phenomenon. It is not that bad a disease. Cataract is curable. It can be cured by a very simple surgery. These days, technology has advanced to a level where the surgery is almost 99% foolproof and gives the patient very good results. Now, the reason I'm talking about cataract and the surgery, the ease of the surgery or the technological advancements is because the world has moved on. We don't really need to wait for the cataract to make the patient totally blind, or if I have cataract, I shouldn't wait till I'm seeing even blurred, and then I wait so that the cataract kind of matures, or in India it is said that the cataract pak jata hai tabhi, motia pak jata hai tabhi operation karana. That is long gone. Now these days we use technology in which there is a stitchless surgery, and in fact, if the cataract is softer, it is easier to operate, and the rehabilitation of after surgery just takes a day or two, and you can get back to your normal working lifestyle. So cataract surgery and cataract per se is one point which I would like to stress on, where a lot of people unnecessarily go around with using half of their vision potential and then delay the intervention, which is actually very easy. Now here's a model of the eye. I would like to talk about how the eye functions, and then I would take on to some other diseases which a lot of people don't really know about, but which affect a large percentage of the population. Now this is an eyeball. The eyeball essentially is a ball. It's an eyeball. It's a ball. Essentially, if you look at the optics of it, it is like a camera. So the eyeball is like a camera. This eyeball is like this. So it's the front of the eye, and this is the side of the eye, and the back of the eye is like a wire. It's a wire which this is the back of the eye, which is the wire, and so essentially we have these two cameras on our face, and there are two wires which go inside and go into the brain. So that's how simple it is. Like we have our watches. There's a glass in front of the watch. That way, the eyeball has a glass in front of it, which is called the cornea. And if I can show you this, this is how an eyeball looks from the inside. So essentially, it's a camera which has a lens in front. This is the lens, and as each camera has a lens and there is a photographic film at the end, the eye has a photographic film which is called the retina, and the retina, or parda in Hindi we call it the parda. That's the film of the eye where the images are formed. So the lens focuses the rays of the light or the image onto the retina, which sees the image, and then the optic nerve or the wire takes it to the brain for the processing. So essentially the diseases of the eye would either affect the cornea, which is the front of the eye, which is the glass of the watch glass, or the cataract, which affects the lens. This lens kind of gets opacified. So if this lens is opacified or there's whiteness of this lens, then the rays of light cannot pass through clearly and you don't see. As simple as that. And the third is the retina. So the diseases which affect the retina affect it irreversibly, and the diseases which affect the retina, I would start about talking about diabetic retinopathy. Diabetes, and there's no pride with which I say this, but India is actually going to become India is the world capital for diabetes. We have the highest incidence and the highest growth of patients of diabetes all across the world. So sooner or later, every neighbor of yours is going to get diabetes, if not you yourself. That's because of our lifestyle, the way we are, our habits. That's a separate topic. But anyway, so diabetes affects the eye in many ways. It increases the chances of cataract, And the worst thing, what happens is in our retina, the film of the eye, it has got many blood vessels. You see, there are these thin blood vessels. These are tubes in the eye, which which are part of that film, the photographic film. They feed the eye. So in diabetes, these tubes get porous. They develop leaks, and blood starts leaking from them. So essentially, the photographic film of the eye gets spoiled because it becomes wet, it becomes soggy. The blood actually starts damaging it. The sad part is that it is a lost battle. If diabetes start affecting your eye, you've already lost the battle. It's only a patchwork which the doctor can do. We can stop further damage, but the damage cannot be reversed. That is why we at Venu, and I personally think that diabetic retinopathy screening or getting your eyes checked up. If you have diabetes, getting your eyes checked whether you have any effect of the diabetes on eye. This is called diabetic retinopathy. It's called DR. If you have any retinopathy, then if it is picked up in the early stages, further damage can be prevented. The problem is that once it's like rust, you know. If your iron object starts getting rusted, the rust is going to sooner or later damage that entire object. There's no way you can prevent it. What you can do is you can paint the rest of the object so that the rust doesn't affect the rest. But the damage which is already done is irreversible. So if you pick up diabetic retinopathy fast or early, then you can treat the rest of the eye so that it does not affect the rest of the eye. Because once it affects, that part is gone. So essentially, if you've got diabetes, or if you know somebody who's got diabetes, you should get their eyes checked. The diabetes should be kept under control, and that would prevent. I'm a diabetic specialist, so I see a lot of patients who I've seen patients over the last 5 years who came to me well enough. I forewarned them that if they don't control their diabetes, they're going to turn blind. And I have a string of patients who've turned blind. I have a string of patients who then beg me to at least give them enough vision so that they can go to the toilet. I don't know if anybody understands this, but a person who needs another person's help to go to for his personal hygiene goes to hell. So I have seen patients who were hale and hearty. I've had not just one, I've seen so many, and who then become blind, and then they would give anything to just get their personal hygiene back. So I'm not trying to scare you. What I'm trying to tell you that if diabetes starts affecting the eye, the only thing you can do is stop further damage. And essentially, that is the gist of it. Now coming to the other diseases, another disease which a lot of people underestimate is glaucoma. Essentially, glaucoma, it's called Kala Motia in Hindi. Glaucoma is the eyeball. It is kind of nourished by a fluid which is secreted from in the eye. That fluid, it's like the fluid comes in and there's an exit. So it's like a wash basin. In the basin you got a tap. The water comes into the basin and goes out through the drain. So the eye also has a kind of a drain sieve all around. This draining sieve in glaucoma is blocked. So essentially what is happening is that water is going in. The eyeball is getting its water, but the water can't go out. So the pressure inside the eye builds. And what happens is when the eyeball, it's like any ball. So when the pressure builds, the pressure starts damaging the structures. And the structure which is most sensitive to pressure damage is the optic nerve. So essentially what glaucoma does is the pressure increases here, and the wire which is carrying the images of what you're seeing to the brain, that wire starts getting damaged. The problem with glaucoma is that glaucoma is symptomless. It doesn't have any kind of, unless you are getting yourself checked, by the time you realize you have glaucoma, the damage is already done. Again, I know so many patients, I know some relatives, who I cursorily examined, and I found that they have glaucoma, and almost 40% of their vision had been lost. And what happens is, again, glaucoma, like diabetic retinopathy, is an irreversible disease. The damage which has already happened cannot be retained. You cannot recover the vision. Like in some other diseases, say I have acidity or I have a kind of a gastric ulcers. So taking acidity to the other extreme, if I have gastric ulcers, I can take tablets and my stomach will become okay and those ulcers will vanish. But in glaucoma or diabetic retinopathy, in fact, most of the serious eye diseases, the damage which has already happened cannot be reversed and the damage is done. The only thing the doctor can do is stop further damage and stop getting the patient to become blind, So in glaucoma, essentially, there are a lot of eye drops. There are a lot of medications. A simple eye drop put once in the day in both the eyes can stop the glaucoma from further damaging the eye. It is as simple as that. So if you're above 40 years of age and if you've not got a comprehensive eye checkup done yet, I would strongly request that you go and get a checkup done. A lot of people take it cursorily. They don't realize things can damage their vision. It affects their lifestyle. It affects their livelihood. It affects their earning capacity. It affects their family, their dependents, and then we can't do much about it. So I think it's a lot of sad talk for a morning, but I would request, again, take this opportunity to request everybody listening to me to get a comprehensive eye checkup done. I believe in it so passionately that even for this talk, I'm already becoming very emotional about it. Thank you so much.